You're with your Feel Good Breakfast show, Expresso, here on SABC3. But let's talk about toothaches for a bit. We know that toothache pain can come at any time with a number of different causes. But the pain may feel dull and constant or sharp and throbbing. But no matter the pain, dealing with a toothache is never easy for anyone and often causes sleepless nights and affects our daily routines. We chat to dental practitioner Dr. Norman Kai about the different types of tooth pain and how to treat it. Dr. Kai, thank you so much for making the time. Good morning.
Good morning. Thank you so much for inviting me onto the show.
Dr. Kai, first things first, what are the different types of toothaches one could experience and what are the common causes?
Let me start off by saying that pain is a very subjective feeling. So by this I mean that one person may experience a mild, dull ache and be very tolerant to the pain feeling, whereas other people may experience an exaggerated response to even a mild sensitivity. So a competent practitioner needs to be very aware of the patient's state of emotion and their history with regards to pain tolerance. But broadly speaking, we divide toothache into either an acute toothache or chronic toothache. So acute means that it's of quick onset and it's got a high degree of severity, whereas chronic toothache means it's been there for a long time and it's either been neglected or ignored either by the sufferer or by the practitioner. And we then take a very comprehensive history from the patient to find out how long the tooth has been sore, what prompted the pain to start. Is it a dull jaw ache or is it a throbbing, excruciating, agonizing pain that's keeping you up at night, that's stopping you from functioning, that's stopping you from eating or drinking? And this is how we come to a diagnosis.
Is there a way to prevent toothaches in the first place? What should we be doing to prevent them, if there is such a way?
With modern dentistry, there's no reason for people to walk around suffering from dental disease and dental decay. And these are the main primary causes of toothache. How do we prevent dental pain? Number one, have good oral hygiene regime at home. What does that mean? Brushing twice a day, flossing once a day, rinsing your mouth out with a good mouthwash. Even salt water is a fantastic antiseptic if you don't have access to expensive mouthwashes. Visit your dentist every 6 months. And the reason we ask for this time frame is not because our bank balance gets short every 6 months. It's simply because that is when we can pick up a problem in its early stages. So that if there isn't a whole beginning or the start of a cavity, we can institute preventative measures such as fluoride or a mild desensitizing agent, or seal the tooth or repair a small fracture or a crack, and so avoid major dental pain in future.
So what generally affects the severity of the pain, doctor?
This depends on the length of time that the dental disease has been left. One of the causes of dental decay or dental disease and causing toothache is receding gums. When gums recede, they expose the layer underneath the dental enamel, which is called dentine. And the nerve of the tooth is just under the dentine. So if the enamel gets worn down through clenching, through grinding, through chemical erosion, people that exhibit poor oral hygiene, that do not clean and brush the plaque away from the teeth, all this can cause damage to the enamel of one's teeth. And if the dentine then gets exposed, it can produce extreme pain and sensitivity. So in the rural areas, they may not have access to good health care, but it's up to parents to teach children good oral care at home. You just need the basics, a toothbrush, a toothpaste, stay away from sugary, starchy foods, drink lots of water, eat lots of fresh fruit and vegetables, stay away from inflammatory foods, stay away from acidic foods.
So other than the sort of over-the-counter medication that you can find, what can we do daily to manage or avoid headaches in particular that come and often can stem from having toothache?
Well, headaches is a complicated issue when it comes to dentistry. The teeth are served by nerves which very often can cause a radiating pain, creating headaches, especially in the temporal regions, in the temporomandibular joint, we call it, joint pain, causing headaches, causing neck aches, causing earaches, causing sinus pain. So the teeth are integral to head and neck pain, because very often people experience dental pain and it's not originating from their teeth. So we need to be aware it could be due to blocked sinuses, it could be due to blocked eustachian tubes which lead to ears, it could be due from a clenching or grinding problem which then needs attention. And these are the factors that can all elicit headaches. So obviously our first line of defense would be anti-inflammatories and antibiotics and painkillers, but we don't want people living on chronic medications. So timeous preventative treatment is crucial to developing and keeping a healthy, happy, pain-free smile.
Dr. Norman Kai, a dental practitioner on call for us here on your Feel Good Breakfast Show. Thank you so much, Doctor, for sharing all of that information with us. Hopefully it goes a long way in assisting people and having people understand a lot more around what they can do when experiencing that pain that stems from toothaches and any other dental complications. Thank you.
Pleasure. Thank you very much.
BRUFEN can assist with a range of pain symptoms such as period pains, back and muscle pain, dental pain, and even headaches, helping you where it hurts the most.
Experiencing pain? BRUFEN works where it hurts. BRUFEN 200 and 400 milligram is not suitable for children under the age of 12 years.